Hi guys, and welcome to today's video. Today's video is going to be a different one than one that I have done before. I'm going to be talking all about clinicals. Clinicals stressed me out my first semester of nursing school. I am now going into my fourth semester of nursing school, if you count summer semester. But yeah, I am going into my fourth one, so I'm in my junior year. I'm entering my junior year, and I'm very excited. But this time last year, I was not this excited. I was so nervous. I was so anxious. Why? Clinical. Clinical is stressful when you don't know what it is. So let me just start by defining clinical. If you're new to nursing school, if you're in nursing school, if you're starting nursing school, if you're thinking about nursing school, don't you love when those plastic things stick out of your shirt? What clinical is clinical experience in the hospital. So you go to the hospital as a nursing student. Sometimes you're assigned a patient and you work with them all day one-on-one. Sometimes you follow your nurse around all day and just watch her and just kind of assist her where you can. And then by the end of nursing school, you're basically the nurse. You basically do everything that they need you to do. And that's just kind of how it goes. My first clinical experience was for intro to nursing? No, Foundations of Nursing. That was last fall, this time last year, which I actually just posted a video on how I studied for that class up here if you want to see it. But that was my first clinical experience. I was on a med-surg floor. I had not taken pharmacology yet, and my school did not allow us to do anything with passing meds until we took pharmacology. My first clinical scenario was not a lot. We couldn't really do anything. We could take vitals, we could follow the nurse around, we could run and grab things from the supply closet if she needed us to, we could give bed baths, we could assist in linen changes, we could assist in, diapers or cleaning a patient, assisting them to the bathroom. Yeah, so it was pretty basic. There weren't a lot of things we were allowed to do. Most of the time we spent shadowing our nurse and just following her around. And if she needed you to run and grab a patient in an applesauce or a bucket of water or a thing to puke in or some wipes or whatever she needed, you could go and get it. But otherwise, it was just a lot of learning and watching her, and I really enjoyed it because although I didn't get to do a lot, it was fascinating to watch. That was my first clinical experience. So last semester, I took mental health, pharmacology, and health promotion and wellness. I had a mental health rotation, so I was on a psych unit. I had a health promotion clinical as well. So those are the three clinical rotations I've done so far. I did Foundations of Nursing, Mental Health, and Health Promotion and Wellness. Mental Health was a psychiatric unit, and then Health Promotion is more of promoting health and wellness from a community standpoint and things like that. Those are the three clinicals that I've experienced so far, and my tips for clinical. The most important tip if you are in a hospital is absorb as much information as you can. Anything your nurse tells you, treat it like gold. Well, not anything, but the majority of things. Nurses are a wealth of knowledge. Please do not think that what they're trying to teach you is useless. I know nursing students that have not appreciated the time that they're given with their nurse, have not listened to the things their nurse had to say, and please don't do that. Sometimes you'll get nurses that don't want to teach. I'll talk about that later, and that's okay. But when you get a nurse that wants to teach and wants to show you and wants to tell you how she charts and receives a report and gives a report and the things she does differently with her patients that maybe not every nurse does, listen to her. I don't think nurses are out there to teach you any wrong information. I think that we're lucky enough to be in a community where a lot of nurses want to teach and want to help nursing students because there's such a nursing shortage. We need more nurses, and I think a lot of nurses know that and they want to help you become a good nurse. So please keep that in mind. Absorb as much information as you can, even if you're just in a clinical setting like I was where I couldn't do much hands-on. My very first clinical, it was just watching. Absorb as much as you can. Things that she say, things that she asks you to do, pay attention. If she says, hey, look at those numbers in their labs, why are they off? Help me figure it out. Pay attention, just absorb as much as you can. That is my biggest tip. You will learn so much from clinical. You will get out of clinical what you give. And if you're willing to give your all and really put the effort into focus and learn, you will get so much. It'll be so rewarding. I promise you. Tip number 2. If you get a nurse that doesn't want to teach you, maybe ask for a new one. If you are having a problem with a nurse, go to your clinical instructor. Your clinical instructor might say to you, hey, I know this nurse didn't want to teach. There were no other nurses to pair you with. You're stuck with it. Figure it out. If that's the case, find your own ways. Find your own resources. Go check on your patient. Go talk to your patient. Maybe just sit and talk with them. If you're in a clinical setting where all you can do is take vitals, check their vitals. Ask them if you can do a head-to-toe assessment on them if you're allowed to do that. Obviously, stay in the guidelines of what your school tells you to do. But if you need to find your own experiences, that's okay. If that means the patient that your nurse is working with is just lonely and doesn't have any family and needs someone to talk to and you have some free time, go sit and talk with that patient. Make them feel cared about. Ask them if you can get them a glass of water if they want some water. Ask them if you can order them lunch if they're able to have lunch. Obviously, stick to the rules and the regulations, and if your patient's NPO, which means they can't have anything to eat, well, don't order them food. But if there are things that you know you can do without getting in trouble, like that aren't going to go against the guidelines or what you've been told, then go for it. I don't think that you have to just sit around and do nothing because you don't feel like you have a nurse that wants you around. I don't think that's the case. I think, like I said, you will get from clinical what you give it, and if you give it your all and you really try and make a good experience about it, hopefully you'll get one. Tip number 3 is find your way of doing things when it comes to clinical. So we're going to start with taking report. If you don't know what taking report is, the day nurse takes report from the night nurse from the night before, and then the day nurse will give report at the end of her shift to the person coming on to night shift. So it's just passing information from one nurse to the next when one shift ends. The way you take report involves a sheet called a nurse brain, is what I've seen them called. So if you Google nurse brain, you'll find them. And they are just pieces of paper that are organized in different ways to help you find the way that you like to take information when you're taking report. But they're organized in different ways, and I think you need to go about finding the one that helps you the most. If you're using one and you don't know where anything is, you're gonna get confused. So find a nurse brain that you like, that you think will work for you, memorize where everything is, and it'll help you fill in information easily, because taking report happens quickly, and if you miss information, you're going to have to go into the computer and look for it, and that's just wasting time. Another thing that I recommend doing for this tip is if you're doing clinical paperwork, which I will talk about in a minute, you will need to go into the chart. What was the patient? What's their age? What's their weight? What's their diagnosis? Have they been in the hospital before? Are they having any procedures? What are their labs? How long have they been here for? When are they going home? Are they going home? Things like that, all that good information. I had originally gone into clinical with a giant stack of like 10 pieces of paper. That was the clinical paperwork that I had to turn in for school, but we couldn't turn it in handwritten. We had to type it in. I was taking these 10 pieces of paper and filling them in, but half the time I was just wasting paper because the majority of that paperwork was questions that I would answer at home. So I was bringing in all this extra paper. So instead, I got a piece of notebook paper and I took what are the important things from those 10 sheets of paper that I had, wrote them on a piece of notebook paper, organized it how I wanted it, and then when I went to the hospital, I only had 1 or 2 pieces of paper that I had to fill in, and the rest I could leave at home, and it made it really easy for me. If your school would allow you to do that, I would recommend doing it. If they say no, you have to bring in all your clinical paperwork, then take it in. Tip number 4, I think. Organize yourself, please. Please show up prepared for clinical. Clinical paperwork is something you're going to do in clinical where, like I said, you're basically writing everything there is to know about this patient. Make sure you're prepared to do clinical paperwork, because if you leave the hospital and you don't have all the information you need about your patient and something comes up and your teacher wants more information on this topic, you can't go back into the chart. You can't go back to the hospital. You can't revert back to anything. So any information you think you need while you're at the hospital, get it. If it's information you don't need and you should not have access to, don't do that because that's illegal. But if there's information that you need, like, oh, I should probably write down all these labs that are bad or out of range. Tip number 5. Bring food to clinical. Please bring food to clinical. Please bring food to clinical. Please bring food to clinical. Whether you pack a lunch, whether you bring money to buy lunch in the cafeteria, whether you bring granola bars and hide them in your pockets, do it. You are going to be hungry at clinical. I'm just telling you right now, you're going to be hungry, because I was so many times. It's an 8 to 12 hour shift depending on how long your school has you there for. That's a long freaking day. We had to be at the hospital at 6 a.m. We had report from 6 to 7 a.m. We were on the floor waiting for the nurses to get there, waiting to get our patients. We did rounds with the nurses. We passed meds. We did rounds with the doctors. We did everything. We were on the go all morning until like 1 in the afternoon. Then we took lunch. Our clinical instructor sat with us at lunch. We got to eat lunch, talk about how our day was going with her. And then from 2 to 4, more clinical. And then we had post-conference from 4 to 5, which is just summarizing our day, talking about how it went. It's a long day. It's exhausting. You're gonna be hungry. So please eat breakfast, even if it's in the car on the way to the hospital. Have a granola bar in your pocket, and if it means nothing's going on, you need to run to the bathroom and take a bite of your granola bar, do it. If you're charting and you need to take a bite of your granola bar, do it. You're gonna be hungry. You don't need to be passing out in nursing school or in the hospital. They have enough to worry about with patients. You don't need to become a patient. Please take care of yourself. Okay, and my computer's about to die. My camera is about to run out of time, so I gotta wrap up this video. I hope you guys enjoyed it. Sorry for me rambling. I hope these tips help with clinical. If you have any questions, post them in the comments below and I'll be sure to answer them. And if you feel like you need more information on clinical, I could definitely do a part 2 of this video. Comment down below if you'd like that. I'll see you guys in the next video. Bye guys!